It's now 1 month since the Russian Federation invasion of Ukraine began. Almost 10 million people, nearly a quarter of Ukraine's population, have now been forcibly displaced. The humanitarian situation continues to deteriorate in many parts of the country and is critical in the Mariupol and Bucha districts. The disruption to services and supplies throughout Ukraine is posing an extreme risk to people with cardiovascular disease, cancer, diabetes, HIV, and TB, which are among the country's leading causes of mortality. Displacement, poor shelter, and overcrowded living conditions caused by the conflict are also increasing the risk of diseases such as measles, pneumonia, and polio, as well as COVID-19. So far, WHO has delivered about 150 metric tons of medical supplies. We have established supply lines from our warehouse in Lviv to many cities in Ukraine, but access to many parts of the country remains blocked. A humanitarian convoy to Mariupol was not able to be dispatched due to insecurity. We continue facing serious cash flow constraints in our ability to deliver life-saving support. So far, WHO has received just $9.6 million against our appeal for $57.5 million over the next 3 months. Last week, I spoke about the humanitarian disaster in Tigray, and that WHO is still waiting for permission to send an additional 95 metric tons of medical supplies. Since then, permission has been granted. If we can deliver these supplies safely, they will help people in desperate need. But much more is needed. So far, only 4% of the needs for health supplies have been delivered to Tigray. That is insignificant. The region has been under siege for almost 500 days, with dire shortages of fuel and food. People are starving to death. Actually, giving them food is more important than medicine. We continue to call on Ethiopia and Eritrean governments to end the blockade.